Hi, everyone. Debbie's just having some technical issues and she'll probably log on in a few minutes. But our presenter today is Sofia Lopes. She's a PhD candidate in the Women's Health Research Unit, and she will start her presentation right now. So, Sofia, over to you.
Thank you, Simpiwe, and thank you everyone for being here today. So I'm going to present the preliminary results of my first article for my PhD work. And the title of the presentation today is Determinants of Women's Empowerment in Mozambique, Preliminary Findings from a Quantitative Study. So empowerment of women has been defined as a priority in the Sustainable Development Goals, specifically through the SDG number 5. But why is empowerment of women important? Well, because first of all, it's a mechanism to tackle gender inequality, but also it promotes sexual and reproductive health rights for women, and also women's active participation and recognition in society and economy. But what is empowerment? There are a number of definitions in the literature, but one is that is most accepted and used is the one proposed by Kabir, where she defines empowerment as the ability to make strategic life choices where previously this was denied. So what we expect is that an empowered woman can freely choose from a number of opportunities and embrace the ones that she considered the best for herself. And evidence shows that women that are empowered, they are more able to make decisions about their own fertility, about using contraception, and also having a better communication with their partners. So empowerment is a process that results from the combination of two key components, resources and agency. Resources are also called preconditions, and they usually are described as education and income. And agency is the actual act of decision-making or choosing. But some recent studies suggest that there are other socioeconomic factors that can also determine the levels of women empowerment. Some of these factors are women's age, age at marriage, income of the household, access to land or property. So the SDG 2018 report on goal number 5 showed that despite some progress in specific areas of women's empowerment, there are sociocultural norms and attitudes that persist as hindering factors for women's ability to make free decisions. At the basis of these restrictive social and cultural norms and attitudes are gender power imbalances and inequalities, and women oftentimes women's decisions are undermined, women's decisions about their own lives, health, reproduction are undermined or even non-existent. In Mozambique, the government is also committed to tackle gender inequalities and to promote women's empowerment. And it put forward a number of interventions, including increasing access to education for girls and women, also to tackle some of the barriers for women's access to healthcare and prevent violence against women. Despite of these efforts, some recent evidence shows that men are still the main gatekeepers in decision-making in Mozambique, specifically when it comes to sexual and reproductive choices, such as fertility and the use of contraceptive. And when we look at some of the main health indicators for women, we see that these fall behind the international goals. So, for example, maternal mortality ratio was 289 deaths per 100,000 live births in 2017. The fertility rate, despite the small decrease from 5.2 in 2015 to 4.8 in 2019, was still high. And the prevalence of use of modern contraceptive, despite the increase of 10%, was still quite low, around 35% in 2019. So empowerment is considered key for how women access and use healthcare services and experience their sexual and reproductive rights. Therefore, a better understanding of the process of women's empowerment and the factors associated with it could benefit health and gender strategies and interventions in Mozambique. So with this study, we aim to identify the characteristics of women's lives that can determine empowerment in Mozambique. And to achieve this, we performed this study in 2 steps. First, we identified the domains of women's empowerment in Mozambique. And secondly, we identified the socioeconomic, demographic, and behavioral determinants of these domains of empowerment. To do this, we used a national survey, the Demographic and Health Survey, conducted in Mozambique in 2015. To give you a bit of background on the DHS, this is part of the USAID program that intends to support countries in measuring and monitoring some key health and demographic indicators. And the DHS program developed a set of tools, of data collection tools that are standardized and allowed to collect data in key issues such as population, health, nutrition, but also on HIV and service provision. And these data sets for different countries can be one can have access to them through the website. One just needs to register and ask for the permission. So going back to the Mozambique DHS, this was a population-based survey covering all the 11 provinces of Mozambique. In this survey, they collected data from women and men, 15 to 59 years old, residents or visiting one of the selected households. So in total, 7,129 households were included in the survey, and 7,749 women were interviewed. For our study, we selected a sample of women based on 2 criteria. The first we included only women of reproductive age, 15 to 49 years old, and we also included women who answer all the sections of the survey, including the section about empowerment, which included only married women, and the section about domestic violence. In the end, 2,072 women were included in this analysis. From the DHS, we also selected the empowerment indicators, and this was informed by the definition that we use for empowerment, which was having the power to control and freely decide over one's life and body in order to achieve valued or best perceived outcomes. So, after selecting the indicators, we coded them into a 3-point scale so that the highest value was given to categories considered to indicate greater level of empowerment. In this table, you can see some examples of the selected indicators and how we coded them. For example, for the first one, who usually decides on women's health care? We coded respondent alone as 1, jointly as 0, partner or other alone as -1. Or for example, for wife can refuse sex, yes as 1, don't know as 0, or no as -1. From the DHS, we also selected some socioeconomic, demographic, and behavioral variables, and this selection was based on the literature and if these indicators could be associated with women's empowerment. So some of these variables were age, education, place of residency, wealth index, access to media, controlling behavior from the partner, and exposure to violence. The first step of our analysis we carried out a principal component analysis to assess how the empowerment indicators cluster around each other and how each of these indicators contributed for each component. We used the eigenvalue above 1 to retain the significant components, and then we applied a Varimax rotation and a Kaiser-Meyer-Olkin measure of sample adequacy to see if our data set was suitable for PSA. And then we finally identified the domains of empowerment. Then for each of the domains of empowerment identified, we estimated an index. And then we divide them into quintiles. And for each of the domains of empowerment that we identify, we created binary variables where the fifth quintile represented the most empowered women and those below the fifth quintile represented the less empowered women. So using these binary variables for the domains of empowerment, we then conducted a logistic regression to estimate the association of the socioeconomic, demographic, and behavioral characteristics of women with empowerment domains. We calculated crude and adjusted odds ratio and respective 95% confidence intervals. So on the first table of the results, we described the socioeconomic, demographic, and behavioral characteristics of the women included in this study. And briefly, we see that most women had primary level of education or no education at all. That only 44% of women were employed, which means most women were not working at that point and at that moment. And that most women were in non-polygamous marriages and they also lived in rural areas. See that 47% of women had no access to media, and media includes TV, radio, newspaper, and magazines. And also that nearly 43% of women reported at least one type of partners controlling behavior, and nearly 23% were exposed to intimate partner violence. We also looked at these characteristics subnationally, and we found some statistical significant differences between the South region, where Maputo, the capital city, is, and the center and north regions. So we saw that in the South, women were more educated, were likely to be employed, belonged to the rich and richest wealth quintiles, had more access to media, and were less in polygamous marriages. We also saw that women from the South had more experienced more controlling behaviors, as well as had higher levels of IPV exposure. On table 2 of the results, we showed the factor loadings for the 3 retained components after the PCA. So on the left side of the table, we see the list of all the empowerment indicators used in the PCA, and we see that for the first component retained, the highest scores were around the indicators about justified beating in different life situations. So we named the first component as beliefs about violence against women, and this was our first empowerment domain. The second component retained, we saw that the highest scores were for decision-making inside the household, for example, on the women's health care or visiting family and friends. And So we named this second component as decision making, and this was our second empowerment domain. Then the third component retained had the highest scores around if a woman can ask the husband to use condoms or can even refuse sex, and we then named this third component as control over sexuality and safe sex, and this was our third empowerment domain. The three retained components explain 25, 19, and 60% of the total variance of the dataset, and adding up to 60%. And the Kaiser-Meyer-Alkin test value was 0.75, which is considered our sample is adequate for the PCA. So for each of these the domains identified, we then performed a logistic regression to identify the determinants of each of these domains. So for the first domain, beliefs about violence against women, we saw that living in a rural area increased the likelihood of empowerment, while experiencing at least one type of controlling behavior, being exposed to IPV, having access to media, and living in the south region of the country decreased the likelihood of empowerment. All the results presented here, the odds ratio presented here, are adjusted for education. For the second domain, decision making, we saw that women of older age, educated at secondary level or above, currently working, living in the south or center regions with increased levels of wealth, exposed to IPV and partners controlling behavior, increased the likelihood of empowerment. For domain 3, control over sexuality and safe sex, we saw that having an education, either primary or secondary or above levels, living in the south region, being among the richest wealth quintile, having access to media at least once a week, having a partner expressing controlling behaviors, and being exposed to IPV increased the likelihood of empowerment. While being 40 to 49 years old and living in a rural area decreased the likelihood of empowerment. So in this study, we identified 3 domains of women's empowerment for Mozambique, and these domains are similar to other findings from other studies for the African context. So we think that this similarity can be partly explained by the use of the DHS, which is the most common source of data about women's empowerment, but also because the number of indicators about empowerment is it's small or it's limited, and that can also influence and limit the capacity to grasp some context specificities. Regarding the determinants, overall, our findings suggest that the domain of empowerment, beliefs about violence against women, is shaped by community and contextual determinants like region, place of residency, and the partner's behavior, rather than by women's individual characteristics. However, in addition to the contextual determinants, we see that the individual characteristics of women also play a role in determining the empowerment in the other 2 domains, decision-making and control over sexuality and safe sex. The partners controlling behavior and the IPV were found to be important determinants of curtailing women's empowerment in Mozambique, and this is aligned with findings from other studies. What this seems to indicate is that each domain of empowerment is measuring different aspects of women's lives, and also that there are unique pathways towards empowerment for each domain. Because first we see that IPV and also controlling behaviors are socially and culturally accepted in Mozambique, and that gives men the right, the power to correct or to punish women. And also women who are exposed to such behaviors, they tend to normalize them and therefore tolerate them. But when women are empowered for decision making and control over sexuality, they also become enabled to identify and report such abusive experiences. And also, they may challenge gender norms and gender power relations. And this can create greater risk of being exposed to violence. This is also referred as a violence backlash. We also saw education and employment that are generally described as essential for empowerment. We saw that for education, our findings support the literature, but for employment, we saw that this was only associated with decision making. And this could be explained by the fact that women in Mozambique and some other African countries, even if they work, they might not be paid in money, in cash, and so they might be paid in kind or even not paid at all. And this could explain this finding. We also saw that region contributes to the levels of empowerment in different domains, while the role of place of residency was less clear, and this also has been found in other studies. But for region, we think that the South patrilineal organization, while the north of the country is matrilineal, so this patrilineal organization could be contributing to women's beliefs about violence. But also the South is where women have higher access to education and urbanization, and this could be promoting more positive gender-based views when compared to the north and central regions, and this could explain the positive relationship with decision-making and control of sexuality domains. Similar to other studies, the relationship between access to media and empowerment was not clear, it's inconclusive, but we think that a possible explanation is that the media are both the vehicle of messages promoting gender equality and preventing violence against women, as well as a place that perpetuates messages based on gender norms. So with these findings, we think that these findings also contribute to understanding a bit better how the decision-making processes of women and regarding contraception and family planning and fertility, and that is our next step. That's the next step of my work. So, despite the contribution of this study to understand and describe women's empowerment in Mozambique, there are some limitations that should be taken into account. The first is that the DHS is a cross-sectional survey, so it cannot be used to infer causality, and also that empowerment is a process, so longitudinal studies would be ideal. Empowerment indicators that are available in the DHS involved only married women, and there is a big gap in the literature about unmarried women and young women in relation to empowerment. We also use a cutoff point in the analysis to identify and define women's high levels of empowerment. However, there is no evidence in the literature that supports, that indicates what is the high level of empowerment. However, we know that other studies have used quintiles as well. And finally, we focused on quantitative measures of empowerment, which is limited by the available data. So some contextual nuances of empowerment might be need to be further explored, and perhaps some new domains of empowerment still need to be uncovered for Mozambique. So in conclusion, in Mozambique, women's empowerment seemed to be determined by both individual and community factors, and this seems to be closely related to the different domains of empowerment. These findings affirm the multidimensionality of empowerment as well as the importance of considering local contexts and community characteristics. Some of the main determinants of empowerment for the Mozambique context seem to be education. IPV and partners controlling behaviors as main barriers for the process of empowerment, as well as region, which seems to indicate that there are social and cultural specificities that need to be considered when designing some strategies for women's empowerment and gender inequality in Mozambique. Although this study offered a step forward in understanding women's empowerment in Mozambique, further studies are needed, particularly of qualitative nature, to explore the meanings and the experiences of empowerment by women. I would like to acknowledge and thank my supervisor, Professor Jane Harris from the Women's Health Research Unit, as well as my co-supervisors, Dr. Deborah Constant and Dr. Silvia Fraga from the University of Porto. I would also like to thank my PhD scholarship from the Portuguese government and the postgraduate research training grant awarded by the Faculty Research Committee of the Faculty of Health Sciences of UCT. Thank you.
Thank you, Sofia.
Thank you. Hi, Deborah.
Thanks, Deborah. Hi. Right, so virtual clap to you from everybody who's on. You've got a wide audience, an excellent presentation, and let's, if everybody who wants to ask questions, if you can put your hand up on the team's little hand icon. So let's open the meeting to questions now, and we'll see if we can do that. And I'll try and help Sofia.
Okay.
I can't see any hands at this point. Can you?
No. No.
Okay. Can perhaps if anybody has questions, perhaps take control of the unmuting. Unmute yourself and just start with a question. If nobody responds, then I have one or two to ask, and I'm sure Jane does as well. Let's just give everybody else an opportunity. Okay, so I'm going to jump in and then perhaps Jane can follow. So Sofia, I was really interested to see that the rural-urban so-called split did not seem to reveal any clear pattern with respect to empowerment. That was a surprise to me. I wonder if you can unpack that a little bit.
Okay. I think, well, this is not different from what other studies have shown, that depending on the urban and rural characteristics, they might have a positive or a negative relationship with empowerment. And this has been shown not only for the African context, for different African countries, but also in other parts of the world. And I think this is very much related to the characteristics of the setting where this is being measured. So I think depending, for example, we saw that rural areas had a positive relationship with the first domain of empowerment, beliefs about violence, And we think, for example, in the case of Mozambique, that in the past decade, there were a lot of interventions regarding violence against women. And because the rural areas they still have very traditional ways of ruling themselves. So the role of the traditional leader is very present. We believe that that because of that, they actually can have a positive effect, because the community still supports each other and controls what is happening. So instead, and then in urban areas, the community support and the community organization is no longer there. So you don't have the presence of these leaders, and so we believe that that's why we see this effect of rural areas, a positive effect on, for example, the beliefs about violence. I don't know if that was what you were looking for, but
yeah, I think it's trying to understand it better. Thanks very much. Anybody else to ask a question of Sofia?
I think there is someone. Yeah.
I see Leslie. Leslie, I see your hands up. Please go ahead.
So thanks very much. It's a very clear presentation. Thank you. It's excellent. Just to follow up on Debbie's comments, I suppose I was thinking about this whole framing of empowerment as an individual agency capacity. Is there any way of locating it in the context of like group or collective agency? I'm just wondering about things, the history of Mozambique and rural women's groups, or, the history of Frelimo, whether there's anything in there that speaks to women in a social context. So instead of considering the individual woman's empowerment as a predictor, there's more some way of taking account of the collective. And I was interested in your comment about matrilineal. I wonder if you could just explain why the rural areas are seen to be matrilineal and what that means in terms of power.
Okay, thank you so much for the interesting comment and question. So the North region is matrilineal, yes. So that it means, so the country is still organized as a patriarchal society, but the way in the North they have a matrilineal organization, which means that the generations to come, I don't know if this is going to be clear, they belong to the woman. So, for example, when a woman gets married, it's the husband that moves to the wife's family, and the decision is made through women, and the children belongs to the woman and not to the man, which is, for example, the case in the South region. And women, there are still rituals in the North region that are for women, where women are taught how to be a woman in the household, and also very much related to sexuality and the sexuality of the women's body. But in relation to the individual versus collective empowerment, that's true. There is a collective, more of a collective organized empowerment that needs to be considered. Empowerment has a change, needs to be also be considered as to become a change, it needs to be considered in the collective. And there is definitely an effect of women's attending community groups and women, and the share of experiences has been reported to promote empowerment. And if I can add, I've started to do my field work, and I'm interviewing some women from Mozambique to understand the meanings and the experiences of empowerment. And something that comes up as important to promote women's sense of agency is actually when they have the opportunity to participate in groups, in community groups, and have and share experiences and heard from other women.
Thanks. Any further comment, Leslie?
No, just thanks.
Okay, I thought that was really helpful. I'm not sure if I can see any hands up because I've only got 12 circles on my screen. I think there are more people here. If anybody wants to ask a question, can you just type that your question in the chat? Alternatively, get in touch with Sofia directly. Jane, can I give you the opportunity to comment?
Thanks, Debbie. No, I think the point that Leslie raised, I was going to comment that maybe it wasn't made explicit in the presentation that Sofia has a quite large qualitative component as well. So it's useful, you know, definitely I think the issue around sort of community support or civil society organizations in relation to aspects of empowerment will be explored, and Sofia just answered that as well. So for the moment, I think I'm fine, thanks. I think some of the questions you raised in relation to region is something we've been talking about, so I don't have anything further at the moment. But thanks, Sofia, for a great presentation.
Thank you, Jane.
Well done, Sofia. Again, another virtual clap, very loud this time. And I see Margaret has her hand up.
Yeah,
Margaret,
there is
Hi, Sofia. No, I'm sorry I arrived a bit late because I had some technical difficulties, but I would love to see your presentation. I would just wanted to ask you to email it to me.
Sure, I will.
Thank you.
Thank you. Thank you for being here.
Well, I heard the end, and I'm sure you were brilliant.
Great, thank you. And thank you everybody for listening in. And do contact Sofia directly if you have any further questions or want to interact with her on this issue. Bye for now.
Thank you.